So in the last video we talked about endogenous catecholamines, and these were noradrenaline, adrenaline, and dopamine. Now we're going to talk about synthetic catecholamines. So synthetic catecholamines, just like all our other catecholamines, have this basic backbone structure, but we add on different groups to the beta and alpha carbon atoms, or the amine groups, to give it its beta and alpha selectivity. So the first one we're going to talk about is phenylephrine. Phenylephrine has a hydroxyl group added on to the beta atom carbon here. And what this does is it would otherwise reduce the CNS penetration, so it's got decreased lipid solubility, and it increases alpha and beta action. But then for our amine group, there's this methyl group that's also attached on. Now, in our guide before and what we discussed in the previous videos, we know that if a methyl group is here, it would normally increase beta selectivity. So based on the structure, you would think, or possibly, this is going to do a bit of alpha and a bit of beta action. But for our catechol ring, it actually has a hydroxyl group missing from position 4. Now what this does is it almost completely removes the beta selectivity for this drug. So it essentially is a pure alpha agonist, alpha 1 agonist, so it will vasoconstrict, but it's not inotropic or chronotropic for the heart. And because it's missing a hydroxyl group from the position 4 of the catechol ring, it's not a substrate for COMT breakdown. So its half-life is longer because it's only our Mayo enzyme that can digest it. So now we'll talk about isoprenaline. And isoprenaline has the similar structure to phenylephrine, but you have the hydroxyl group on position 4 added back to the catechol ring. And you have these extra methyl groups that are added on to the methyl group that's attached to the amine group. So the molecule is essentially the same as adrenaline, with the exception of the isopropyl amine substituent, which confers more beta selectivity, but it doesn't make it specific for any particular beta receptor, so it's both for beta 1 and beta 2 receptors. And because of the large ethylamine tail, Mayo doesn't break down this catecholamine at all, but it has the hydroxyl groups added back on to positions 3 and 4 of the catechol ring, which means that it's broken down by COMT. And this reduces the half-life of the medication, meaning its half-life is a few minutes. Next, we'll talk about salbutamol. And salbutamol has a similar structure to isoprenaline, which we described as a non-selective beta agonist, but salbutamol is a selective beta 2 agonist. So it has this butyl substituent that's added on to the amine group, which makes the amine group larger. But then also on the catechol ring, it has at position 3 this methyl group with the hydroxyl group added on. And what this does is it increases beta 2 selectivity. And because you have this large amine group with the methyl groups as well, you then have very selective for beta receptors, but specifically beta 2 selectivity because of the changes to the catechol ring. The other important feature of this is that the ethylamine tail on the end is very large. So again, Mayo won't touch it. And because you've had this change to the catechol ring as well with the hydroxyl groups, COMT can't metabolize it very well either. So the half-life of salbutamol is about 90 minutes. Now, even though it's got beta 2 selectivity, at higher doses, it will start to spill over into the beta 1 selectivity sort of area. And what this will do is cause tachycardia and cause more chronotropic effects, as you see with people who are receiving lots of salbutamol. Lastly, we'll talk about dobutamine. And dobutamine is an interesting catecholamine because it has this humongous ethylamine tail that's added onto the amine group with the methyl groups all branching off. And what this does is that because it's a large group, it makes it very beta selective. More specifically, it's a potent beta 1 agonist, and beta 1 receptors are found in the heart, which makes this drug inotropic. It does have some partial alpha agonistic effects on alpha 1 due to the hydroxyl group that's added on to the beta atom carbon, as you can see here in orange. But this is more a fact of the different isomers within the racemic mixture of dobutamine that's given to the patient, which essentially means that you've got the same chemical that's there, but the orientation is different. So we know that positive dobutamine isomers have practically no alpha agonistic effects, but they still bind to the receptor, but essentially make it an antagonist, as they've got no intrinsic activity or no activation of the receptor, but just block it. Both of the isomers within dobutamine are beta-2 receptor agonists as well, but they're only partial, so they're not very strong activation of beta-2. So overall, what dobutamine is it's a potent full beta-1 agonist. It has some partial alpha agonistic effects and some partial beta-2 agonistic effects. So that brings us to the end of this video where we covered most of the synthetic catecholamines. If you're a little bit lost in this video, it would be worthwhile watching part 1 and part 2, where part 1 we talk about the backbone of catecholamines and the structure and function, and talk about beta-phenylephrine. And then in part 2 we talk about endogenous catecholamines such as noradrenaline, adrenaline, and dobutamine, which we also use as drugs to give to patients. Thanks for watching, and if you have any questions or anything that you want to add, feel free to leave it in the comments, and don't forget to subscribe as well.